Well, we have many young members and older members. And so my partner, Jason Cuéllar, is a MD, PhD in orthopedic surgery. His lovely wife, Vanessa Cuéllar, also an MD and orthopedic surgeon. That we all work together in the office here in Beverly Hills. And I'm going to tell you a little bit about Vanessa, who's going to speak to us. She got her bachelor's in immunology and microbiology at UCLA. And from there, she went to Stanford University in medical school, where she met Jason and they got married. Now, while she was in medical school, she did additional research. And there she did it in non-viral gene therapy and also therapeutics based on inflammation. And a lot of us here have a lot of inflammation, if you haven't noticed. And so looking at protease inhibitors, things that really do reduce inflammation. So she has a lot of research in these areas. After completing medical school, she and her husband, Jason, both go to NYU to the Hospital for Joint Diseases. There, doing her orthopedic surgery training, she continues to do additional research, looking at molecular biomarkers of inflammation, and there, looking at the molecules specifically that cause joint degradation, joint pain, and breakdown and furthers to disease. Leaving NYU, she comes back to USC, where she specializes again in a fellowship in hand surgery and upper extremity disorders. And her practice now is it looks not just at the patient's orthopedic condition, and what we try to do is look at the whole person. And Vanessa really is our go-to person here because she does an in-depth analysis of your genetic markers, your molecular markers, your dietary markers, your hormonal markers, to look at the processes leading to the inflammatory conditions that are bringing you to see us, whether it's spine, joint, and upper extremity. So she really does an integrative practice of Western medicine and holistic medicine. She's also, when I went to Jason's 40th birthday party, I walk in and Vanessa is an expert violinist playing concert level violin. She's fluent in French, Spanish, and Bulgarian, as well as has a master's in art history. Other than that, she doesn't know anything. So here's Vanessa, and let her take the lead.
Hello, everyone. Well, that was a great introduction, Todd. Thank you. I think it took everyone's mind off of being kidnapped for a couple of minutes. But I don't blame you if you're on the edge of your seats during the rest of the talk. I'm not certainly going to be as interesting or as entertaining or as anxiety-provoking, I hope. So it's really a pleasure to join you today. I've heard about all of your adventures from Dr. Landman, and I know you're truly an extraordinary group, so it's really an honor to be a part of your annual meeting. My presentation today is just a glimpse into my research and philosophy, and it challenges sort of what one may call a traditional medicine. I call my approach to medicine whole body health and well-being, and I'm going to just present today some powerful tools outside of the traditional healthcare system and demonstrate what a whole body health assessment might look like and the potential to take this information and profoundly change your sense of well-being. Great. I'd like to talk about several different diagnostic options and treatments based on cutting-edge research that's available to you now and that will ultimately have a significant effect on your health. So I decided to start the presentation with some of my own research and some of the clinical questions I've had over the past 12 years or so that have led to more in-depth questions in my practice. I'll try to explain what the potential is beyond traditional medicine and what is truly the future of healthcare in personalized medicine. So we're going to start with some of the misconceptions that we may have in everyday medicine and some novel or innovative treatment strategies. So one of the most commonly affected joints for joint pain is the knee. It's extremely common for people to have increasing knee pain as they age and to be arguably diagnosed with what I think is mistakenly considered a disease of aging, presumed to be a result of aging, which is also known as osteoarthritis. So here on the left is an x-ray of a normal knee. These other two x-rays show signs of degeneration and aging. There is narrowing of the joint space. There are bone spurs. There's bone spurs, sclerotic bone formation. These are two x-rays of two knees in two different patients. So by and large, despite some details, they're largely the same with the same amount of signs of aging and degeneration. However, despite almost identical looking x-rays, these two patients have vastly different symptoms. One of them is a healthy volunteer that has really no major history of knee pain and is very active doing the things that he enjoys and loves and doesn't really consider his knee to be a problem. The other one, however, has debilitating knee pain and is told that they'll ultimately end up with a joint replacement. So why is that, and how can that be? How could patients with terrible looking x-rays have minimal to no pain and others with minor findings have nearly debilitating pain? Well, instead of the traditional path of taking scientific principles and applying them to the clinical scenario, what we call bench to bedside research, we took the clinical picture and took it back to the lab. So when someone normally has arthritis and knee pain, the traditional approach is very familiar. You do some exercise, some therapy, try some injections, have some pills, and ultimately, when all else fails, you proceed to surgery. But in our research, we wanted to delve deeper, beyond the end result. The end result is an abnormal x-ray and joint pain. But where is this coming from? We know that there has to be more to the picture because we're overwhelmed with examples of patients with minimal to no pain with an abnormal x-ray or debilitating symptoms with either a normal x-ray or one with severe findings. I'm going to present some innovative treatments for joint and musculoskeletal pain that go beyond the conventional options because clearly this is a group that goes beyond the conventional. We wanted to understand on a molecular level what was going on in each patient individually. And furthermore, is there a way we can predict who will go on to have worsening pain and arthritis? We took synovial fluid, which is joint fluid, from patients undergoing surgery, and then also from their contralateral asymptomatic knee or from the knee of a healthy volunteer. We looked at a plethora of molecules all at once. And this was novel because traditionally in the past, we would always analyze the few known proteins that we knew were involved somehow in joint pain or degradation, and we'd go after them one after another. Our approach, looking at all these different molecules, came across to many as what we'd call a fishing expedition, okay? But guess what? We changed the field, and we changed the way people started thinking about musculoskeletal pain. Traditionally, we saw osteoarthritis and joint pain as a de facto part of aging, that it was inevitable wear and tear, that your control is taken away from the patient, that we're victims of the inevitable. And your knees hurt because you're getting old. And this is just not true. Not only do we have the molecular science to prove it, but our research enabled us to develop a product based on these discoveries to actually break the cycle and go beyond traditional medicine. So briefly, our results. We gathered synovial fluid from patients and analyzed it for all the molecules that were present. And we found several distinct proteins, which we call biomarkers. We then correlated these proteins to the patient's symptoms, to the clinical findings in surgery, and then even followed them out for a few years to see how they were doing and see if we could predict patients that maybe didn't have pain but had these molecules, if that could predict that they would go on to have pain and arthritis and signs of aging over the years. We started to understand on a molecular level for each individual patient which factors were at play. So this is just one example from our studies, which shows which what we call cytokines or inflammatory molecules are elevated in painful knees with meniscal tears, and we compared it to knees that also had meniscal tears but didn't have pain. So none of the patients that were asymptomatic necessarily knew they even had a meniscal tear until they got an MRI for the study. They thought they were volunteering as a healthy, painless knee. We found that the degree of pain and the disability, as well as your risk of progression, what used to be thought as aging, was really due to inflammation. Our studies elucidated the key molecular players at work, and they all have something to do with inflammation. We actually identified a novel protein, which we call FACT, that is the most powerful biomarker of joint pain available to date. And we found that if we could interrupt this cycle and actually target the inflammation and target this protein, then we can interrupt the aging and degenerative cycle. So I won't be presenting all of our data, but we do have studies in animals that convincingly show that our targeted therapeutic actually prevents the development of arthritis, for instance, after a knee injury, like an ACL tear. And this is a game changer. Okay, it's an absolute game changer. And for those of you that aren't familiar with the osteoarthritis market, which in the 7 major markets is expected to grow to a $3.5 billion market in the next few years, a drug that can be developed to change the course of degeneration is nothing short of a blockbuster. Okay, there's nothing even remotely like it on the market today. we identified this protein, alpha-2 macroglobulin, which we call A2M, which is a known powerful anti-inflammatory protein that's been studied for decades in other contexts. It's unique in what we call a bait and trap mechanism, sort of like a Pac-Man approach. And it's critical to our research because this protein specifically inhibits, it specifically baits and traps all of those molecules that we looked at and identified associated with inflammation and joint degeneration. It specifically targets the molecular players known to cause joint disease and what was previously attributed to just wear and tear and age. It has a small area that literally baits inflammatory proteins and the enzymes that are known to break down cartilage, and then traps them and sequesters them from the circulation. Our work has been repeated in many studies, and this is just one example where it was independently verified by a group at Brown University. So the way we use it now as an FDA-approved product is we isolate it from the patient's blood. The protein is concentrated using this special filter, and it's injected into the area of pain and gets to work. Our results are outstanding all over the body. We have examples in hips, in knees, in the spine, everything from tennis elbow to plantar fasciitis. And so not only does this protein, this A2M protein, decrease the inflammation and sequester those enzymes that are known to accelerate cartilage degeneration, but we're actually taking out the key players in an aging body. So we're not only restoring it to a pain-free state, but we're also giving it the opportunity for rejuvenation. So taking it a step further, our team of molecular scientists in the lab have developed what we call a recombinant version of the protein. So this version is more efficient, more effective than the native type that's already produced by the body. And this is important because this can be potentially developed as a drug or as an off-the-shelf shelf type of product, which eliminates the need to concentrate it from the patient's blood. This approach is really revolutionary because unlike other quote-unquote alternative treatments that you might have heard of, stem cells or PRP, this one is actually based in hard science. And we have an actual understanding of the mechanisms behind why it might work and why it might actually work in so many other disease states. And what is perhaps the most exciting is that it has been so successful all over the body in so many different applications. Here's just a list of a few of the areas that we've been using it successfully. And what this list does is it just underscores what we've sort of been discussing, the common denominator not only to all of our research, but to all areas of degenerative disease, is everything is due to inflammation. So what is inflammation? Well, it's very complicated. And traditionally in medicine, we've studied it sort of in isolation with each disease that it's with respect to each disease. But what we're coming to understand, and is really what is the key approach to our medical practice, is that it's really the common denominator in almost every disease state, in every disease of non-well-being. So inflammation is not only just responsible for musculoskeletal disease and joint pain, such as I just presented to you, but also for cancer, for dementia, cardiovascular disease, obesity, even anxiety and depression, and the list goes on and on. So when it comes to whole body health and well-being, what do we mean? Well, for one, we say well-being at all ages. And the notion that as you age, that you somehow become less healthy is not based on any scientific evidence or any biologic laws or any fact of necessity. Some of us become conditioned to think of health declining as we see it in others, and we take it as the inevitable. But it's not. The research I just presented to you shows that there are underlying molecular reasons for joint degeneration, and it shows that we can specifically target this process and actually change the course of aging. So to maintain well-being at all ages, we do need to understand how the body works and how to optimize it at every stage of life. And the bottom line is an anti-inflammatory state. So if you basically remember one thing from this presentation, besides the fact that no one's been kidnapped yet, is that this is the keystone. Okay, this is the holy grail for whole body health. And I guarantee you that as other physician scientists are jumping on the bandwagon, and they are, and the research is going to keep pouring out over and over again, you will see it, that it is the key factor in treating all disease states. You're going to see it in heart disease, you're going to see it in the news for obesity, for chronic fatigue, for Alzheimer's, and essentially for all forms of cancer. So we're just going to spend the rest of the time discussing some new frontiers in molecular and genetic medicine and some simple steps to unleash tremendous potential in your health and your medical evaluation starting today, and what I feel is really a true turning point in healthcare and personalized medicine. So before we get to the future, we'll just spend a minute discussing the status quo. The status quo is what we usually call traditional Western medicine. I am a Western trained physician, and by no means am I trying to undermine its value. And certainly if you're having a health crisis, if you're having a heart attack, we are second to none. You don't want to be any other place than here, but in the hands of specialists. Okay. But how patients get to that critical breaking point, that's what I'm interested in. Can we be just as passionate about preventative medicine and understanding the underlying reasons for why we end up at that end point as we are about dealing with the emergency? The traditional framework is probably familiar to you all. If you tell your physician you're fatigued or not sleeping well or constipated, most likely you'll be prescribed a pharmaceutical. And we are truly blessed to have such easy access to pharmaceuticals. But we call this a pill to the ill. So it's very quick to get Ambien if you're not sleeping well, a stool softener, maybe testosterone if you're feeling fatigued or not having the energy you used to. These all clearly have their place and value. But we see complaints more readily assessed, more readily addressed with medications, with far less emphasis on investigating the underlying cause. So similar to the knee pain, you're often treated with modalities to treat the symptom without anyone ever really delving deeper into, well, why is this happening to you? What's going on in the knee joint to actually cause this pain? And can we actually address that root problem rather than just the symptoms? So, I argue that we are offered treatments now that have no basis in the molecular underpinnings, and we should really take advantage of the wealth of information and research that we have available now for more personalized care. Moreover, the traditional Western medicine specializes in what I call the cult of the specialist. Our culture is such that if you have a problem, you need to see the specialist. You don't generally just see your internist if you have a kidney problem. You want to see the kidney guy, the person that's really at the forefront of this. And while that has its benefit, it also has the effect of what we call when you're a hammer, everything is a nail. And we see that the more super specialized we get, the more we focus on our niches, and we consequently end up breaking down the patient into a component of all its multiple problems, and each being addressed in isolation by different doctors, and very little attention is generally given to the whole picture. But we have the information about inflammation and its detrimental effects. We know it can be involved in the majority, if not all, disease states, and we know that early intervention can profoundly change the course of a person's health, including how they age. So let me show you how we can implement it today. Where do we begin? Our practice, for example, offers a comprehensive, customized workup that truly goes beyond conventional medicine. And as you know, I'm trained in molecular biology and genetics, and so I like to use these skills to sort of look at the body as the whole of its molecular parts. So we're going to start with some broad diagnostic testing. I think it's slide. So we look at where a patient is currently. We look at their genetic risk, their biomarkers of inflammation, and an in-depth analysis of the actual energy-making process in the body in its current state. So we know that while you can't change your DNA, you can change how it's expressed. I think I was using that slide for that. We take all this information, come up with a plan to optimize your energy production and reduce your inflammation. And this is personalized medicine. So here are some of the examples of the types of studies we offer and what some of the reports look like. I spend hours on each patient's report just poring over, trying to make sense of the whole picture. And clearly we don't have time for that today, but this is just enough to give you an idea. We look at the metabolism of your carbohydrates and your fatty acids in detail at all levels of their byproducts of energy production. We can also measure your level of oxidative damage and the levels of antioxidants in your body, as well as your ability to detoxify. We analyze all of your neurotransmitters, the function of your red blood cells, and perhaps what tends to be becoming increasingly more important is looking at your heavy metal levels, because I've seen more and more this be a problem in patients, the increased levels of aluminum, arsenic, mercury, lead, and cadmium. So to better illustrate, I'll just give you a case example of how we use this information. We had a 68-year-old woman who was the CEO of a major company with a tremendous responsibility under a lot of stress in everyday life, and she complained of a general sense of malaise, gaining weight, not sleeping well, and just not feeling like she was performing as she had been over the years. Workup revealed that she had what we call a sex hormone disruption, but also a significantly elevated level of arsenic and mercury, likely from fish and water consumption. So these heavy metals are known to interrupt the cholesterol and testosterone metabolism pathways. So while the traditional response would have been to just treat her low testosterone, with our integrative approach, we were actually able to decrease the heavy metals in the blood, and as a result saw the sex hormone levels stabilize. And this example isn't to say that patients wouldn't benefit from estrogen or testosterone supplementation, but if the underlying cause isn't addressed, then you just aren't getting the full benefit. Her heavy metal levels were interrupting her cholesterol metabolism and consequently her testosterone and sex hormone production at multiple steps, and it wasn't allowing her body to function optimally. She also found that it was the cause of her low testosterone and energy that was increasing her cortisol or stress levels and putting her body at risk for staying in a highly inflammatory state. Furthermore, heavy metal testing is also important because we have evidence that cadmium and lead in particular affect what's called telomere length, which is directly related and responsible for aging. We also offer genetic testing for inflammatory markers, some of the same markers you might or might not have noticed on the list we went over earlier, such as IL-6, interferon, IL-1 beta, and TNF-alpha. We know that variants in your genes can make one person more prone to pro-inflammatory substances and can make you vulnerable to pain or chronic illness and accelerated aging. IL-6, for instance, affects fat tissue metabolism as well as your cholesterol levels and your risk for developing diabetes. We look at the gastrointestinal system and look at all the individual bacteria in your gut, how they interact with each other. And this sample report just shows you how each bacteria can be analyzed with respect to various diseases such as chronic fatigue, mood disorders like anxiety and depression, your risk of diabetes. It's even been associated with things like autism and dementia. This shows you the relative concentration of various microbes as markers of inflammation in your stool. And just in general, the list of microbes that we can look at is really staggering. We can also undertake a comprehensive analysis of all the inflammatory reactions to various foods, looking at the antibody levels to these foods circulating in your blood, and very often we get very surprising results. And in certain patients, it's appropriate to undergo an extensive sex hormone analysis, and we look at every step of the pathway rather than just the end result of what your testosterone or estrogen levels are. And we sometimes find that toxin screen is also warranted, looking at environmental exposures to, say, plastics and pesticides, which also can cause a substantial amount of inflammation. So what do we do with all this information? Well, we integrate into the results into a plan for an anti-inflammatory lifestyle that can profoundly affect how your body works and how it ages. We identify changes that are needed in diet and lifestyle and use the information at hand to develop personalized molecular therapeutics where indicated. And really, this is just the beginning. Health is just as formidable as illness, and we are much more in control of our health and well-being than the current system leads us to believe. Science is unstoppable, and it's bound to progress in spite of itself. We will keep coming up with cures. We will keep treating illnesses and extending and prolonging life. But as with every other field, it's really thinking outside of the box where the progress becomes exponential. So from being able to analyze the proteins in your knee to predict your risk of painful arthritis, to looking at these proteins, how they're circulating in your blood, and how they affect all the other metabolic pathways in your body, this isn't just personalized medicine, it's powerful medicine. Thank you.